let's talk about children who have life-threatening illnesses. How do you handle that, situation where they're asking very delicate questions? So a child who has a life-threatening illness, how do you go about that?
Children are also beneficiaries of palliative care, but we'll realize also from I think it's our culture, we tend to shield children from tough diagnoses and tough conversations. So pediatric palliative care, which means palliative care for children, is also something that is coming up in Kenya and should be provided for those children who are suffering. In this support, the patient, being the child, is usually part of the continuum of care, but you have to involve a caregiver, whether it's a parent, whether they're in a children's home, whether they are somewhere where they are adopted or something. The care focuses on the child, so we need to remember to involve the child in the conversation. So depending on their developmental stage or their age or how they understand things, it is possible to talk to children about their tough illness. For example, we have a lot of children with HIV. How do you talk to them about and making sure that they take their antiretroviral medication? Because that is part of palliative care. You're improving their quality of life. So you need to have the support of the child as well as the caregiver who stays with the child. And we've also seen that if you do this early, children actually do cope well with illnesses. It's us as parents who tend to shy away.
Shield them.
Yes, or we think that it will be too devastating for them. So we talk to them about their symptoms. We talk to them about the medication. They might be on lifelong medication. We talk to them about doctor's appointments. They'll be missing school, so you need to consider when they're in the hospital, they are receiving their medication. Is there a way facilities can also make sure that they are getting some form of education while they are in hospital or when they are at home? Because sometimes they might have a condition that requires them to be isolated because of their low immunity.
When it gets to a point that a patient needs to receive palliative care at home,
Yes.
what are some of these factors that are considered, and also how do you prepare the family to ensure that they're ready to take care of the patient at home?
Most patients who have actually been interviewed prefer being at home for their care. The biggest challenge is the caregivers. So there's a lot of counseling that goes on for the patient as well as the caregivers, so that they're able to accept or they're able to allow the patient stay home with them. But you'll find that most of these patients will be stable patients. For example, they might have a stage 4 malignancy, or they have a spinal injury that is making them not able to move. But the caregiver who will be staying with them needs to be taught about the basics of care of this patient. So turning the patient, feeding the patient, if they have a wound, what care should they institute, changing if they are on diapers, making sure they are dry, so how do they change if they are on a catheter. But the biggest thing is for them to accept that this patient has a life-threatening condition, and this patient will do better at home than being in the hospital, because when they're in the hospital, they're actually incurring more cost in terms of the bed charges per day, and it's something that they might be able to get at home. So some actually do get like a home care nurse to visit them maybe every day or every other day to support them in the care. But the caregivers also need to be supported because they also experience burnout, same as the healthcare workers. So they need to take breaks and they need support of other family members.
Let's talk about the availability of palliative care management in Kenya today. If you can compare where we were about 5 years ago and where we are today, how is that doing?
Let's talk about 2010 and 2019. We had about 7 hospices when palliative care services were actually starting in Kenya. And there's the organization called Kenya Hospices and Palliative Care Association that works as the umbrella body for coordinating palliative care services across the country. So the aim is to ensure that we have quality palliative care services for all in need. As of 2019, we now have 17 hospices and a total of 70 palliative care provision centers. So in Kenya, we have palliative care being provided in what we call hospices, which are standalone community-based organizations. So we have them in different counties. And then we have palliative care units, which are located within health facilities. For example, Kenyatta National Hospital has a palliative care unit. So there's the mix, there's either hospital-based facility or a standalone facility, but they all work together, and hospices are actually able to go and visit the patients at home. So that's the biggest difference for us, but they all offer palliative care services from the time of diagnosis.
Which are some of these cities or towns in Kenya that have, these palliative care centers? Yeah.
At the moment, we have about 30 counties with palliative care service provision centers. Nairobi County has the Nairobi Hospice. We also have the Kenyatta National Hospital Pain and Palliative Care Unit. And then the other 30 counties, we still need to get to the 17 counties to get palliative care.
Yeah.
But Western Coast, Northeastern, Nyanza, we do have palliative care service provision. A bit of challenge getting to the northern part of the country, but Garissa does have a palliative care site. Wanja is coming up, but they still need for more advocacy, and that is what KEPCA and its partners are trying to do.
What do we need to understand better about palliative care?
And what KEPCA is actually doing is trying to empower patients to be advocates for palliative care, because they are better at telling their story. So we encourage those who have received palliative care services, share the information with someone else. Those who have seen someone who needed palliative care services, they need to support the patient and avoid the stigma, because some people now think it's death. When you're told you have a certain diagnosis, you have renal failure, for example, you think you're going to die. But as a community or as a Kenyan population, it's important to remind us that we need to support this patient to live. Even if they have 2 more days, they need to live the best of those 2 days. So palliative care is looking at improving the quality of life. So you as a patient, you as a caregiver, myself as a general public or whoever is watching, has a role to play. Everyone has a role to play, and palliative care is everyone's business.
Thank you so much, and we really appreciate, and we end at that note, that palliative care is about improving the quality of life. Palliative care is about your business, it is also my business. Thank you for watching this week's edition of Wanja's Health Diary.